Hello, I'm Professor Jayakar, Professor and Head of Department of Dermatology, Sri Balaji Medical College, Chennai. I am going to talk today on one of the common conditions that we see in day-to-day practice, namely urticaria, and also going to touch on some aspects of its management. Allergic diseases are common among the general population worldwide. Among these, urticaria, and specifically chronic urticaria, is likely to affect 20% of the population during their lifetime. Often associated pruritic wheal and flare reaction, which may be associated with angioedema, it can also cause pain for some patients. Factors triggering the onset of urticaria can be identified in some, but in most of them it is idiopathic, that is about 50 to 80% of all cases. Through this understanding, as therapists, our best option to manage this condition is to avoid identifiable triggers wherever possible, but mainly to counter the allergic pathophysiology of urticaria using antihistaminics. While all international guidelines recommend non-sedative second-generation antihistamine as the first line of treatment for urticaria, it is difficult to select the ideal one, as the commonly prescribed ones lack efficacy, for which we need to add or updose current available antihistaminics according to patient profiles. Today, I will be talking on belastin, which is a new second-generation H1 antihistamine with ideal antihistamine characteristics and which has recently been introduced and launched in India. Belastin has been approved in more than 100 countries globally and has decentralized approval in 28 European countries with large and extensive clinical data studies conducted on more than 5,000 individuals with more than 22 million patients using belastin worldwide. Belastin is considered the first choice antihistaminic among the Asian Pacific physicians. The allergic rhinitis-induced asthma recommends belastin as the highest scoring antihistaminic amongst all the second-generation antihistamines, and it is the only one to achieve a perfect 10 in the antihistaminic scorecard. In India, it has recently been approved for the symptomatic treatment of allergic rhinitis and chronic urticaria in patients over 12 years of age. The Asia-Pacific physicians' review on the selection of optimal second-generation antihistamines for urticaria in Asia has also given its support to belastin study. Belastin's robust clinical assays and studies in healthy volunteers compared to the actual accumulated clinical experience, belastin has a profile of adverse events similar to that of placebo and does not appear to significantly influence cardiac conduction, alertness, or driving ability, even in doses of up to 40 milligrams. At therapeutic doses, belastin does not have anticholinergic effects and does not affect psychomotor performance. Belastin is a good substrate for the P-glycoprotein, which would limit its passage across the blood-brain barrier into the brain. As it shows relatively zero brain H1 receptor occupancy compared to others, incidence of sedation with belastin is similar to placebo even in doses 4 times the approved dosage, that is up to 80 milligrams. Studies show that it does not have any effect on driving ability and flying condition, and hence no effect on cognitive impairment as seen with other antihistamines. In fact, during on-the-road driving test studies, belastin does not show significant differences compared to placebo. Even when tested in simulated conditions of high-speed driving of cars, operating heavy machinery, and amongst pilots, belastin did not induce significant side effects. An active control arm study comparing hydroxyzine with the standard dose of belastin, namely 20 milligrams once daily, and even high doses belastin of 40 to 80 milligrams once daily, found no significant effects on various objective measures of psychomotor and driving performance with belastin at all doses. As a clinician, I would certainly look forward to using belastin as it checks most of the boxes for the qualities needed for a non-sedative antihistamine. Belastin has been acknowledged for the use by guidelines such as the allergic rhinitis-induced asthma, and it is the only one to achieve a perfect 10 in the antihistaminic scorecard, and it's also been scrutinized to become the first choice antihistamine among Asia-Pacific physicians.